Hello, and thanks for joining us today for another TissueGnostics webinar. My name is Carly Briffa, and today we're joined again by our guest, Dr. Lukas Kenner from the Department of Pathology at the Medical University of Vienna to talk about his project on investigating the impact of micro and nanoplastic particles on human health.
I was asked to talk a bit about another project which I have recently, a big funding I got. Maybe you're interested in that. So I was basically puzzled a few years ago about the possibility that microplastics, which are around all over the world and massively increasing in the environment, whether they could lead to cancer formation. And this was before Corona times, and since I'm a pathologist, I was shocked that there's no publication out on microplastics in health at all, at least not in the mammalian system or in humans, and started to basically investigate the possibilities if I can use our big tumor banks, which we have in Austria, not only in Vienna, but mainly also in Graz, where we have the European Biobank with 80 million patient samples to facilitate the research on these particles if there's any health impact due to treatment. So the background is that microplastic or nanoplastic particles, which is a question of size. So microplastics start with 5 millimeter of size and smaller, and nanoplastic particles are basically everything that's smaller than 1 micron, so 1 micrometer. And the source is basically, one important source is packaging materials, but also paint, rubber, tire wear. So tire wear is one of the most important, obviously, because every car tire sheds about, on average, several kilograms per 50,000 kilometers. So it's a lot. What affects us or what could affect us, and in the Western countries we have an ingestion of up to 5 grams of these particles per week. So this is like a credit card, basically, like the weight of a credit card. So it's not a small impact. Yeah. And we have still very limited findings or research going on here. And our main interest is so if there are effects on cancer development, on the immune system, and also on the microbiome. So we have several working groups in Austria working on that, but also a lot of international partners already here. So the question is, and this is I can tell you a very complex situation because these particles, and I will come to that in a minute, are rarely pristine. So the pristine plastics are also in some products we use, like in toothpaste or in beauty products, but 99% are basically coming towards us due to the decay or use of products like hair ties, but also like decaying plastic also bottles in seawater, for instance. Yeah, and these are carbohydrates, which are basically organic matter, so they can bind easily to other things. Yeah, and they also absorb contaminants or not only contaminants, also in the sense of viral bacterial particles, or even living bacteria, for instance. And the question is whether this can lead then to, at the end of the day, to cancer formation. Yeah. So our main goals are determine the effects on surrounding environment, let's say in the gut, for instance, so on the microbiome, interact investigate the interaction of these particles with different drugs. And we already know that they interact with drugs from computer simulations. So one part of our project is computational chemistry people who calculate basically on a huge computational effort the possible effects on a chemical level with computer power, and then establish predictive biomarkers to allow direct risk assessment. So this is also something which is very important. Also in Europe, we have this initiative of this Green Europe movement from the European government, and this is a big part of it to get this in a safe or direct this in a more safe way, the production of plastics and the use of plastics, and then of course develop recommendations for politics and for industry. So what do we do? So basically, on the left side here, you see we have a broad international consortium, which are our collaborators with different universities all over the world, like Cambridge, then Eppendorf in Germany, Hamburg, Nottingham, Vilnius. These are different universities, but we also have partners like Tissue Agnostics, who are also in Australia, where you guys are, and in Austria, and different other companies. And what we do is basically we do prepare plastic particles. This is not so easy because you have to imagine that we don't know what we are looking for, because these plastic particles decay or they are not produced. So you have a situation where you need to produce the secondary. We call it secondary because it's a result of decay and of usage of plastic products, and that these particles have specific sizes, specific shapes, which we don't know. So we have to really analyze these tissues, for instance, with different technology, and this comes from microscopy to electron microscopy to Raman spectroscopy and so on. So, and then what we also want to do, or we are already doing, we label the plastic particles and evaluate them with like micropet systems and different other imaging technologies. And then we also investigate the interaction of this plastic particles in, let's say, tissue samples, for instance, from patients, but also from our mice. And of course, we use also the possibilities of our transgenic mouse modeling, which we have in Vienna. And so we want to, basically use state-of-the-art or beyond state-of-the-art research, because we do a lot of development of technologies. And we want to basically bring this up into discussions on the political and economic level, also with our industry partners, to improve this situation of this avalanche of microplastics in the environment. And of course, we need to look for further funding. We have now 4 million euros for 4 years. The first year is already gone, so we need to find new technology and new funding possibilities. So here, unfortunately, maybe you cannot see that. So we started already with a very cool technology, which is which we don't have in Austria, but in Hamburg, in Germany. This is a synchrotron where we basically use plastic particles with a metal core, like thallium or palladium and palladium, and we already can show when we do an input-output measurement, which nobody obviously has done, then depending on the lesions, and in this case we did colitis lesions, up to 35% of the microplastic particles which you ingest. And remember, this is 5 grams per week. then 35% stay in the system. So that's a lot. Yeah, and we are doing different modelings to investigate this technology, this impact on the health system. And then this is something we already published. So we were surprised that so when we started this project more than a year ago, and when we wrote it, it was not clear whether plastics would even go into the system. So therefore, we focused on colon cancer because we knew from our partners in Vienna that in human stool or feces, microplastic can be found. Yeah, and we saw that in our mice when we feed them different plastic particles. So we have different polystyrene particles, for instance, with different sizes and different fluorescent colors. When we feed them into the mice, then after 2 hours already, you see these plastic particles in the brain, which was a bit shocking to us. And with our computer modelings, we could see that these particles easily can overcome the body barriers and also the blood-brain barrier by a Trojan horse effect, by basically, in this case, engulfing themselves, or we call it corona. So but it's not a virus. It's just that these particles have in this case cholesterol molecules around them, and with this basically Trojan horse effect, they can easily enter the blood-brain barrier. And this is just a model, a computer model, which shows that. And so the dark black particles basically are the plastic particles, and the gray balls here, this is the cholesterol particles. And with this Trojan horse effect, and this is in real time, basically they can enter very quickly into the blood-brain barrier. And this is just one thing which we just published, but just to show you what we also do in our research. Well, with that, I think I'm at the end of what I wanted to show you. This is my group basically. Christine is up here. It's the GB130 mouse model and the data, and Emine works on the metabolism in prostate cancer. And this is basically the main thing I showed you. And Verena, who is here, does the microplastic project. She's a postdoc, and we are now hiring some students to do more research in the microplastic project. And I just wanted to mention here that Jotina Batra and Robert Ecker, which are very precious cooperation partner of mine, together with tissue agnostics, we do together different projects, and the technology they have is really cool. So this is for pathologists, a real El Dorado, and I'm very happy that you have them in Australia, so you can also appreciate their precious scientific knowledge and technology. And with that, I thank you very much for your attention.